Hello, this is Adrienne Cruz, HR Manager at Henderson County Schools, and today we're going to be talking about health insurance open enrollment for 2014. Open enrollment for 2014 is a mandatory active open enrollment. All members who are active with our agency must enroll between October 1st and October 31st, 2013. Active employees, KTRS retirees, and KCTCS enroll online through the CRIS ESS system. Anyone who cross-references or members with a disabled dependent or any KRS or CERS retirees must complete a paper application. Something different for 2014 is if you do not enroll or do not go online and fill out either a waiver or an enrollment, you will be defaulted into a single standard CDHP health plan. The cost of this plan is $12.98 for non-tobacco users and $52.98 for tobacco users. Something else that's different for 2014 is there are no free plans. Additional new items for 2014, there are no costs for in-network preventative care. Preventative care includes such things as immunizations, preventative screenings, well child, and well adult visits. All KEH plans cover an extensive list of preventative service as long as it's in-network, without charging co-pays or co-insurance, even if yearly deductible hasn't been met. Also, expanded dependent eligibility is new for 2014. So regardless of your situation or your children's situation, from the age of 19 to 26, they can remain on their parents' plan. This is a little bit different from last year. Last year they said that if it was offered through a child's employer, they had to take it. But this year, regardless if they are offered insurance or married and their spouse is offered insurance, as long as they're under the age of 26, they can be covered on the employee's health plan. The tobacco use question is different from 2013. This year, the question states, within the past 6 months, have you or a spouse or dependent to be covered under your insurance plan used tobacco regularly? Last year it stated, have you smoked in the past 2 months? This year they are including all tobacco products, which means cigarettes, pipes, chewing tobacco, snuff, dip, or any other tobacco products regardless of the frequency or method of use. Another thing that is new for 2014 is that smoking cessation programs through Humana are covered. That includes prescriptions such as Chantix and things along those lines. 2014 open enrollment, the new plans for this year are, every plan has a different name. Living Well CDHP, it requires a Living Well promise. This plan is comparable to last year's Commonwealth Maximum Choice. There's Living Well PPO, which requires a Living Well promise, and it is comparable to Commonwealth Optimum PPO. There's Standard PPO, which was previously the free plan, and the new plan for 2014 is Standard CDHP, and this is a completely new option. Waiving coverage and flexible spending counts are still available, and there is no capital choice for 2014. The Living Well Promise is part of KEHP, or Kentucky Employees Health Plan's overall wellness program. By completing the steps of the Living Well Promise, members can access the best benefit plan options, learn about their health status and history, learn about and understand their health risks, and take action to get and stay healthy. The Living Well Promise requires members to agree to do two things. They promise to take the Humana Vitality Health Assessment between January 1st and May 1st, 2014, and keep their contact information current. A shortcut to the link to take the Humana Vitality Health Assessment is located on the Henderson County homepage. What you'll do is you'll scroll down to the picture of the apple with a nurse and click on that, and that gives all kinds of links to anything in reference to open enrollment. One thing about the Living Well promise is if it is not fulfilled between January 1st and May 1st, 2014, members will not be allowed to enroll in the Living Well plan options for 2015. So both members of the Living Well cross-reference plan must take the health assessment on Humana Vitality, and dependents can but are not required to take the health assessment. So basically all adults that are on the plan must take must fulfill the health assessment through Humana Vitality. I'm going to go over the options now and the differences. Living Well CDHP is a new option. A CDHP is a consumer-driven health plan. It covers 100% of in-network preventative care. It has an embedded health reimbursement account, or HRA. Single coverage receives $500. Couple, Parent Plus, and family coverage receives $1,000. Use towards deductible and maximum out-of-pocket. That's what you use the HRA for. It reduces deductible by 40% and maximum out-of-pocket by 20%. The HRA funds roll over to next planned year if the CDHP is elected again, and the members' balance from maximum choice plan in 2013 roll over to this plan. So if you had maximum choice in the past, it would roll over, whatever money you had would roll over to 2014. This plan offers the lowest annual out-of-pocket maximum option and the best coinsurance percentage. Living Well CDHP, this is a chart or a couple of charts on how it pays. As you can see, the single, you get, if for a single plan you get $500. Family, you would get $1,000. The deductible for a single plan is $1,250. For family, it would be $2,500. Out of pocket cost for single, it would be $2,500. For family, it would be $5,000. Once you meet your your deductible, your coinsurance would be 15%. So the plan would pay 85% and you would pay 15%. One thing to note on this plan is everything is subject to deductible, even prescriptions. So whenever you're choosing this plan, please be sure to be aware that any kind of prescriptions, you would be paying full cost for those prescriptions until your deductible is met. Living Well CDHP is comparable to maximum choice, like I stated before. Once you meet your deductible, your doctor visit would be 15%. If you go to the hospital or have an inpatient or outpatient procedure or stay, you would pay 15%. Preventative care, you wouldn't pay anything, and that's regardless if you've met the deductible or not. Emergency care or urgent care facility, you would pay 15%, and any kind of therapy services such as physical therapy or occupational therapy, those would be covered at 15%. Pharmacy, as I stated before, it is subject to deductible, so any kind of prescriptions are subject to the deductible. The generic, you would pay 15% after your deductible is met. Formulary, or also known as name brand, you would pay 15%. And non-formulary, also known as compound drugs, you would pay 15%. 90-day supply, once again, once you've met your deductible, you would pay 15% of those costs. Living Well CDHP, their monthly premiums for a single non-smoker or non-tobacco user, the cost would be $47.98. Parent Plus, the cost is $122.98 per month. Couple, the cost would be $287.98. Family, the cost would be $337.98. And family cross-reference, the cost is $77.98. If you are a tobacco user, the cost for the Living Well CDHP would be $87.98. Parent Plus would be $202.98. Couple would be $367.98. Family would be $417.98, and family cross-reference is $117.98 per month. The cost on these plans, especially the family plan, are a little bit smaller than in years past, which is a good thing. The next plan we're going to discuss is the Living Well PPO, which is comparable to the Commonwealth Optimum PPO. The Living Well promise is also required for this plan. It covers 100% of in-network preventative care, just as the previous plan does. So any kind of well child visits, well adult visits, mammograms, those types of things are going to be covered at 100%. This plan features copays for some medical services and all pharmacy services. It is the second lowest coinsurance at 80%, plan paid, and 20% member paid. It has lower deductibles and a higher premium. And the out-of-pocket maximum is the same as with the Living Well CDHP, but with no HRA funds to help reduce costs. The Living Well PPO, for in-network benefits, the deductible for a single plan is $500, and for family it is $1,000. The out-of-pocket maximum for a single, it's $2,500, and family it's $5,000. In coinsurance, it's a 80-20 plan. So once your deductible is met, you would pay 20% of costs. For the in-network benefits, the doctor visits for a primary care physician, your copay would be $25. For a specialist, your copay would be $45. Hospital inpatient or outpatient, it would be subject to deductible, then 20%. Preventative care, it would be covered at 100%. If you go to the emergency room, you would have to pay a $150 copay, and whatever services are subject to deductible, then coinsurance. If you go to an urgent care facility, the copay on that service would be $50. And then any kind of therapy services, such as physical therapy or occupational therapy, it would be subject to deductible, and then you would pay 20%. This plan offers pharmacy copays. For a 30-day supply, a generic copay for prescriptions would be $10. Formulary, or also known as name brand, the cost would be $35 per month. Non-formulary, the prescription cost would be $55. For a 90-day supply, generic prescription copay would be $20, formulary would be $70, and non-formulary would be $110. The cost on these plans are a little bit more expensive than the Commonwealth Optimum was last year. For single, the premium is $79.98 per month. Parent Plus is $227.98. Couple would be $512.98. Family Plan would be $642.98, and Family Cross Reference would be $152.98. For a tobacco user, a single plan would cost Tobacco user single would cost $119.88. Parent Plus would be $307.98. Couple would be $592.98. Family would be $722.98, and Family Cross Reference would be $192.98 per month. The next plan that we're going to go over is the standard PPO. This plan does not require a Living Well promise, so if you don't want to go on and do the Vitality health assessment, this is one of the plans that you could choose. It covers 100% of in-network preventative care. Pharmacy costs are 30% of the total in-network prescriptions within the minimum maximum range. Third lowest coinsurance at 70% plan paid and 30% member paid. Premiums are the same as Living Well CDHP and higher deductible than Living Well PPO. There are no HRA funds available on this plan. The deductible for the standard PPO, for a single person it would be $750. Family would be $1,500. Your out of pocket for a single would be $3,500, and family it would be $7,000. So once your deductible is met, the plan would pay 70% and you would pay 30%. The in-network benefits, doctor's visits after deductible has been reached, you pay 30%. Hospital inpatient and outpatient after the deductible has been met, you pay 30%. Preventative care on this plan is also, you pay 0%, so it is free. Emergency room, it also has a $150 copay and then the deductible and then coinsurance. Urgent care facility, you pay 30% after the deductible, and therapy services such as physical therapy and occupational therapy, you pay 30%. Pharmacy, or any kind of prescriptions that you receive, you're going to pay 30% within the minimum and maximum range. For generic, you have a minimum of $10 copay and a maximum of $25. Formulary, or also known as name brand, minimum of $20, maximum of $50. Non-formulary or compound drugs, the minimum of $60, maximum of $100. 90-day supply for generic, the minimum would be $20, the maximum would be $50. Formulary, the minimum would be $40, the maximum would be $100. And non-formulary, the minimum would be $120, the maximum would be $200. The rates for these plans are the standard PPO. For a non-tobacco user, the single rate would be $47.98. The Parent Plus rate would be $122.98. Couple would be $287.98. Family would be $337.98. And Family Cross-Reference would be $77.98. Standard PPO tobacco user single plan, the employee contribution would be $87.98 per month. Parent Plus would be $202.98. Couple would be $367.98. Family would be $417.98. And Family Cross-Reference would be $117.98. The last plan that is completely different from any other plan that we've had previously is the standard CDHP, or Consumer Driven Health Plan. There is no Living Well promise that is required with this plan. It covers 100% of in-network preventative care. There is an embedded HRA account, so for a single person they would receive $250. Couple, Parent Plus, and Family coverage would receive $500. You can use this money to reduce the deductible and the maximum out of pocket. Member balances from the Maximum Choice plan in 2013 also roll over to this plan. So if you had Maximum Choice last year, or I'm sorry, in 2013, you could roll that money into this plan. It does offer the lowest premiums per month, but you will pay a higher deductible on this plan. This plan is also the default plan option, so if you don't do anything during open enrollment as you've been instructed, you will automatically be defaulted to this plan at a single coverage level. The standard CDHP, your health reimbursement account, as I told you previously, you would receive $250 for a single plan. Family would be $500. Your in-network benefit for a deductible, your single deductible is $1,750 and family would be $3,500. Out-of-pocket maximum single would be $3,500. Family would be $7,000. So once your deductible is met, the coinsurance, the plan would pay 70% and you would pay 30%. Please be aware that all medical and prescriptions are subject to deductible. There are no co-payments with this plan until your deductible is met. Your in-network benefits for a doctor's visit, you would pay 30%. Hospital, both inpatient and outpatient, you would pay 30%. Preventative care is free, you wouldn't pay anything. Emergency care, both ER and urgent care facilities, you would pay 30% after your deductible. And therapy services, you would also pay 30% after your deductible. For pharmacy, after you've met your deductible, generic, you would pay 30%. Formulary, you would pay 30%. Non-formulary, you would pay 30%. 90-day supply prescriptions, after your deductible, you would pay generic 30%, formulary 30%, and non-formulary 30%. The cost for the standard CDHP employee contribution would be $12.98. Parent Plus would be $72.98. Couple would be $262.98. Family $312.98, and Family Cross-Reference would be $32.98 for a non-tobacco user. For a tobacco user, your employee cost would be $52.98. Parent Plus would be $152.98. Couple would be $342.98. Family would be $392.98, and Family Cross-Reference would be $72.98. If you have waived your coverage previously, that option is still available for 2014. You have 3 options when you're waiving your coverage. You can receive a waiver health reimbursement account. Members receive $175 per month or $2,100 annually to pay for qualified medical expenses. All $2,100 would be loaded onto your Humana Visa card. January 1st. You could receive a dental vision HRA. Members receive $175 per month or $2,100 annually to pay for qualified dental and vision only expenses. If you are covered by Medicare, this dental vision option would be a possibility for you. Waiver coverage with no HRA, members receive no funds. So if you're a retired person and you come back to work and you're on your retiree's insurance, then you can waive and receive no funds into your HRA. Members who currently waive coverage must actively elect to waive for 2014 or will be defaulted to the standard CDHP with single coverage, and the cost on that is $12.88 a month. So make sure that if you did waive last year and you want to continue to waive, to go log on and do follow the directions. One thing to note is please consult your spouse's HR department prior to waiving coverage. The question that needs to be asked of that person is, if coverage is offered through my employer, do I have to take it? A lot of employers are going to mandate that if a spouse is offered insurance through their employer, they must take it. And if you don't ask the question and it comes back and they find out that you were offered and didn't accept it, then your husband or spouse's plan could possibly drop you. So it's very important that you ask that question. Flexible spending accounts. Flexible spending accounts allow members of participating agencies to set aside money from each paycheck before taxes to pay for certain health care and dependent care expenses for the member or member of the household. The funds are preloaded onto a Humana Access Visa card. The member should only set aside as much as they will use during the current calendar year. It is a use it or lose it account, and funds can only be used for 2014 plan expenses. There are two types of FSAs, or flexible spending accounts. There's a healthcare FSA. It covers eligible healthcare expenses. FSA funds can be used for family members who are considered tax dependent. 2014 limit for contributions to a healthcare FSA is $2,500 per employee. And FSA funds can be used to pay for medical and prescription deductibles, co-payments, and co-insurance. There are certain dental fees such as cleanings, fillings, and crowns, orthodontic treatment, vision fees including contacts, eyeglasses, and laser vision correction, medical supplies such as wheelchairs, crutches, and walkers. There are also a dependent care FSA offered to employees, and this allows members to pay for dependent care expenses such as daycare and after-school programs for dependents up to 13 or an adult daycare. Maximum contributions based on the member's tax filing status for dependent care is $5,000 for married filing joint return, $5,000 filing as head of household, and $2,500 married filing separate return. This is a chart to help understand the difference between FSAs or flexible spending account and waiver HRAs. As you can see, an FSA, the funds do not roll over, and this is money that comes out of the employee's paycheck. The waiver HRA, the funds do roll over, and no expense is given to the employee whatsoever. So make sure that whenever you're completing your online enrollment, you understand the difference. There are several options as far as wellness options and some other things through Humana Vitality. There's going to be Humana Health, and then there's Compass Choice Rewards. The links to this information and other programs that are available through Humana are listed on the Henderson County homepage, and once again you'll click on the picture of the apple and nurse. If you need additional specific information, Kentucky Employee Health Plans have set up webinars to help you navigate through open enrollment. You have been emailed this information, but if you want to know about plan comparisons, you can sign up for a webinar on October 1st, October 8th, or October 10th. The link to that is on the email that you received. If you want to understand more about the Living Well Promise and Health Assessment demo, the dates for this demonstration would be October 1st and October 8th. If you need to know how and when to enroll, the dates on that is October 8th. Additional plan benefits free to members, so if you want to know more things about the Compass Choice Rewards or Humana Vitality and smoking cessation, things along those lines, the dates for that is October 8th and October 10th. If you would like to know whether you want to do a consumer-driven health plan or a PPO and whether you should switch or not, October 1st and October 10th are the dates for those webinars. HRA and FSAs, if you need more specific information about those, you can sign up for the webinars on October 1st and October 10th. I will also be coming to provide help sessions to all locations, and the calendar was provided when you signed for your enrollment book. And feel free, if you have any other additional questions, to contact me or come to the help session, and I will be more than happy to help you with this process. Thank you. Have a great day.